all hear the slogans, save the Tata, think pink, and pink is stronger than you think. These slogans bring about awareness for breast cancer. With October being Breast Cancer Awareness Month, I felt like this topic was appropriate and fitting. Breast cancer is a common form of cancer and can be treated with early detection and treatment. Cancer starts when cells begin to grow out of control. Breast cancer cells usually form a tumor that can often be seen on x-rays or felt as a lump. Breast cancer occurs in mostly women, but can also occur in men too. According to breastcancer.org, about 1 in every 8 U.S. women will develop breast cancer over their lifetime. Breast cancer is a serious disease in which many women are diagnosed with it every day. Reading information from an article on susangkomen.com, there are more than 3.5 million people who have been diagnosed with breast cancer living in the U.S. today. Symptoms may be different, and some people do not have any signs or symptoms at all. Some signs are a new lump in the breast or armpit, thickening or swelling of part of the breast, redness or flaky skin around the nipple area, pain in the area of the breast, and any change in size or shape of your breast. Keep in mind that these symptoms can happen with other conditions that are not cancer. Breast cancer can spread outside the breast through blood vessels and lymph vessels. Studies have shown that a woman's risk of breast cancer is due to a combination of factors. Most breast cancers are found in women who are 50 years or older. Some risk factors for breast cancer are things you cannot change, such as getting older or inheriting certain genes. These make your risk of breast cancer higher. Breast cancer is sometimes found after symptoms appear, but many women with breast cancer have no symptoms. This is why regular breast cancer screenings such as mammograms and self-examinations are so important. If breast cancer is detected, treatment plans are based on the type of breast cancer and which stage you are in. Most women with breast cancer will have some type of surgery to remove the tumor or even remove the breast, which is called a mastectomy. But with early detection, breast cancer can be slowed down or stopped. Chemotherapy for breast cancer uses drugs to target and destroy breast cancer cells. These drugs are usually given directly into a vein through a needle or as a pill. On September 13, 2019, Susan G. Komen, the world's leading breast cancer organization, announced $26 million in funding for new research projects that focus on breast cancer. The money goes to developing new and more effective treatments. As I was reading the article, I came across a statement that said an estimated $6 billion is raised every year in the name of breast cancer. To date, there is still no cure, but with advancements in technology, the survival rate is higher than it used to be. Back then, around 20 years ago, if you had breast cancer, it was like a death sentence, and there was no hope. Chances for survival varies by the stage of breast cancer. Non-invasive stage 0 and stages 1 and 2 have a better prognosis than later stage cancers, stages 3 and 4. Stages 4 is the worst, and it is when the cancer has spread beyond the breast and nearby lymph nodes to other parts of the body. The 5-year overall survival for women with stage breast 1 cancer is over 90%. This would mean more than 90% of women diagnosed with stage 1 breast cancer survive at least 5 years beyond diagnosis. Overall, the survival rate varies by breast cancer stages. People diagnosed with stage 0, 1, or 2 breast cancers tend to have higher overall survival rates than people diagnosed with stages 3 or 4 breast cancer. However, overall survival rates vary depending on a person's diagnosis and treatment. With survival rates being good, hopefully in the end, a woman's slogan would be, I beat cancer. In conclusion, with breast cancer being a terrible obstacle for someone that is diagnosed with it, they are not alone. Their loved ones, friends, and families also are affected by it. Someone who is diagnosed with breast cancer will never fight alone. Save the tatas, think pink, and pink is stronger than you think will be said for years to come until this cancer is cured. Thank you.